Yeah, I can, sir. Have you called an ambulance, though?
Can you go back outside, please, outside the gate?
I can, but have you called an ambulance?
Can you just go back outside the gate, please?
can,
What's your name?
My name's David with New South Wales Ambulance.
David. Who opened the gate?
The gate was open when we arrived, sir.
Well, it shouldn't be open.
Oh, it was open when we arrived.
Yeah, well, I rang up David, and who are you?
Kevin. Kevin is a student with me, and my other partner is Ashley.
Ashley, okay. I just spoke to Adam on 000, okay?
Yeah.
Now, I instructed him. Where are you from?
I'm from Ryde Ambulance Station.
From Ryde?
We were the closest available vehicle when you called it 000.
No, that's good. That's okay. I instructed you can come in. Yeah. You can come in. Dave, what's student David? What's your
Kevin?
Kevin.
My name is Kevin. And Ashley.
Hey, nice to meet you.
Ashley.
And what was your name, sir?
George. And what's your name?
Ashley.
That's right. How do you spell Ashley?
Ashley.
K-E-V.
I-N.
David, I can see that. No,
George, what can I do for you today?
no, well, listen, let me just explain myself. I don't normally greet people like this, but in the past, I've been abused and traumatised by paramedics from Northmead Ambulance Station, and on a couple of occasions, and I found them to be unfriendly and seemed to be Christian haters.
Sorry, what was that word?
Christian haters, anti-Christian.
Oh, sorry, I haven't heard that expression.
Yeah, anti-Christian, and just come inside, and I won't keep you out here.
That's okay. Well, George, what can we do for you today?
I'll just tell you inside, mate.
That's okay.
I welcome you into my home, okay?
Yeah, well,
Because you've come to help me.
After you, sir.
No. But Adam on the phone, he...
Would you be more comfortable just sitting on a chair out here with me, or?
No, come inside. Come inside.
Go wait outside, Ash.
All of you's come in.
I mean, George, is
No,
there
can I...
camera rolling, or
I just told you the reason.
just because you've had bad experience in the past?
I've had a lot of bad experience. Sit down and make yourself at home.
That's okay.
Grab that phone there, Mel.
Is that the one? There you go.
All of you sit there and make yourself at home. Would you like a cup of tea?
No, thank you, George. Can I just borrow your wrist? I just want to check your pulse while we're chatting, okay?
Yeah.
So, George, what have you called the ambulance today for?
Look, I told the people on the phone.
You said there was notes about some lower back pain.
And, look, I've got hemoglobin below 67.
Yeah. Do you have iron in symptoms for that?
I've got cancer in both lungs.
Yeah.
I've got pelvic cancer. You can come and sit down, Ashley.
Yeah, I don't appreciate being filmed, that's all.
Beg your pardon?
She doesn't like being filmed, so...
You don't like being... Well,
She
listen,
says-
love, everyone's got dash cam. And if you do a good job being filmed, are you worried about doing a bad job?
No, she's not at all.
Well, she must be, mate.
No. George,
got-
to be honest, it doesn't make me very comfortable either, but... you
Well,
know,
listen, it's
we
not a
are
matter
here
of
where we are.
comfortable. It's a matter of necessity.
George, I'm just going to take your temperature in your ear, okay?
Just, Ashley,
Yeah.
just come in here. You're part of the people.
Yeah, I don't
I'll give you a compliment if you do a good job, but if you're bad, people scared of cameras and normally got something to hide.
I'm just the driver today, so I'm not doing my job yet.
Doesn't matter. I got cameras all over the house. You're already on the camera.
You got hay fever. You got hay fever.
No, go away, Mella. Let me explain everything.
So we've got the cancer in... you've got a lot of cancers there, George.
Yeah, what they told me at Westmead Public Mel, just go away, all right?
No, I'm not going away.
Don't complicate things. Let me explain, okay? I know exactly how the situation. That's my carer.
Okay.
She's been doing a great job. Yeah. On about the 18th of November, 2020, pre-COVID, my surgeon said,
Am I okay to, sorry
you
to
got-
cut you off, George. Am I okay to get a blood pressure on this arm?
Yeah, man, go ahead.
Okay.
Yeah.
Do you want me to get a sorry, George,
Yeah,
do you want
man.
me to get
Would
a
you-
backpack with some leads on
Mel,
Yeah, if you want to start doing
Mel,
4 lead or 12?
go away. But just don't
I'll just get
complicate things, all right?
I'm just going to, George, while we're chatting, Kevin's going to set up an ECG to have a look at your heart.
Sorry, do you mind if I move this cushion out of the way or?
Yeah, thanks. You're very polite, Kevin. And look, you're welcome to have a copy of this
No, that's okay, George.
because, I think you're doing a good job.
Well, at the moment, we're not supposed to accept any food and drink from patients just to the COVID risks.
Okay, no, it's just.
But no,
I'm
I appreciate-
hospitable.
I appreciate the offer,
It's
though, George.
Easter time. Easter time. I know there's good and bad in all jobs. A lot of corrupt police. A lot of corruption everywhere, actually.
Okay, that's not too bad.
Is it okay?
Yeah, your blood pressure, it's up a little bit, but it's not too bad.
I'm
If you're-
taking 80 milligram of what's it called, Teltart or something like
Yeah.
that.
Telmisartan?
Yeah, Myocardis.
Is that your normal medication?
Yeah. I just take that. Sometimes I wonder why. But,
Yeah. Well, sometimes you need it sort of upped or downed occasionally.
yeah. What's it, Ashley? You can sit out in the front veranda if you're
That's
so
okay.
paranoid of the camera.
I'm still listening.
I don't know why you're so paranoid of the camera. I got cameras. I got 8 cameras all around the house.
Alright, I'm just gonna start putting these dots on just all over your legs and your arms. Just
Yeah,
okay?
yeah. Thanks,
A
Kevin.
lot of people just don't like being filmed, George.
Oh, come
Regardless
on.
of-
Yeah, you know why? Because they've got something to hide.
No.
Yeah, it's
Oh, some
like the
people, yeah.
ICAC. They filmed and they've caught Gladys Berejiklian, and Scott Morrison doesn't want to
Nobody
allow
wants
it.
to know. But George,
Because I tell you what, where credit's due, I always write letters to say people done a good job,
Yeah.
and if they've done a bad job, you've got to speak up. Otherwise, the situation gets worse.
But George, going back to today, what was the main reason you've called the ambulance for today?
The main reason was the pain I'm having is getting worse.
Okay.
The
Where-
pain, the pain, can I take that off?
Yeah, I can pop that off.
Is that the oxygen okay?
Yeah, oxygen's 100%. Sorry, 100% at the moment. So
Yeah, apparently that's because of the hemoglobin low. It
Sorry,
works overtime.
well, usually if your hemoglobin's low, I'd expect your oxygen levels to be down a bit because your blood doesn't have the oxygen carrying capacity.
No, well, maybe you're right.
Your
but-
body might just be
but another
compensating.
another paramedic
Sorry,
told
can I
me
just flip your arm? There we go.
if
I may well be wrong, but
no, well, another paramedic said the opposite. He said your body's working harder
well, yeah,
to
you,
get the oxygen.
Yeah.
I know you're not a doctor,
well, it can be also that you're
he seems,
compensating very well. at the
But I
moment.
hope you're right.
Yeah.
I've been.
But it also could mean that if you go up and walk around, it's going to drop a lot quicker than if you had a higher hemoglobin level.
Look,
Because your body doesn't have the sort of
look,
the,
my doctors.
the
I
reserves.
got 2 great GPs.
You get high, excuse me,
Mel.
high fever every day.
Mel, just let me
high
talk.
fevers every day.
Yeah, it goes up to 38.
Have you done a rat test, the little thing up your nose?
No, it's not that. It's what this.
But have you done one?
I don't want that, mate. I don't want that. I had that in the hospital, and
It's not the one that feels like it's tickling your brain. It only goes in about that far.
Yeah, look, they're not 100%.
No, they're
reliable.
not. But if they're
Well, if it's not 100,
they're a good indication. If they're concerned, they then do the
no,
one that feels like
if
it's going all the way
something's
in.
not
Sorry,
100%,
I just don't want to cut you off, guys. I just need to place this on your chest.
Yeah.
Do you want me to? Are you okay lifting your shirt up? Is that all right?
yeah. What are they?
They're just to check your heart
look,
out on
yeah.
our monitor. That's it.
You're going to be like that good girl from
Sorry.
Northmead Ambulance Station. Her name's Jessica. She shaved first.
Oh.
You usually got to take off a bit of hair. If you got the hair, it doesn't.
No,
give a
but
good
she
reading.
shaved it
That's
first,
what we're
and it
saying.
makes
Yeah.
it easy to take off.
Yeah,
You want to do that,
we
Kevin?
probably will need to shave a little bit of hair off there, or it won't get
Kevin,
a good
this
reading.
I have to note this lovely paramedic Jessica from she come here from Northmead Ambulance Station. She comes from Tamworth, a country girl. She shaved it all and took it off, and
In the top.
there was no pain.
Yeah.
In the hospital, they don't even do that. They just rip it off. So
No, I thought they would have shaved
in the hospital, no.
because they don't.
Westmead
doesn't always
Public
get a
Hospital
reading
is a
properly.
third world hospital, David. I can tell you that. I was there when it opened up. It used to be a great hospital, mate.
No, you can.
It used to be
Yeah,
a
I can-
very good
Yeah,
hospital.
just drop it in the shafts when you're done.
Yeah. Yeah. Okay.
So going back to your new pain today,
Yeah.
is that consistent with the pain you usually have with all your health concerns? Or
It's worse.
have you had any falls or anything
No.
like that recently?
I got a cane there, walking cane, and I go for a walk with that. Always
Sorry, is
remember
it a
do-
little bit sharp?
No, that's all right. Remember that, Kevin. You're learning.
Yeah. Yeah.
And this people appreciate that little touch, you know.
Mhm.
So what have you had for the pain so far today, George?
Mel, just keep out of it. I can't think with Mel. I don't want to have a two-way.
No, she's trying to be helpful with an electric shaver because that can be.
No. Look,
horrible
Kevin
ones.
knows what he's doing.
I hope so.
So George, what have you had for the pain so far today? And what do
I've taken endone.
Yeah. Did that help at all or not?
Endone helps a bit, but it's doesn't last long, and it's still I don't like it what it does to my body.
No. Okay. Just with
I took that was it. I took that at
it's about.
I took
1
that
o'clock
to-
now, I think.
took that at 11:25 a.m.
Do you know what?
3:35 a.m. I took a Valium,
Yep.
and that sort of helps a bit with it's trying to sleep. And before that, 2:10 a.m. I took 2 Osteomol.
Oh, sorry, if you don't mind now.
Yeah, no,
2:10 a.m. for the Ostomol.
Yeah, from Western Sydney University.
Yes.
You know the pay
Sorry,
to
could you just-
pay to play there,
They paid to
pay to play degree. The people come in from overseas and get a degree.
Well, that's all the universities offer international students. So.
Yeah, but they should be failed, but they passed. The vice chancellors.
That was a few years ago, wasn't it?
No, it's ongoing. It was on Four Corners, and it's ongoing. That's why you got substandard doctors at Westmead Hospital, like bloody.
So, George, I'm just going to cut you off there. Going back to your pain today, whereabouts does it start, or where is it worst, I should say?
You want me to stand up?
No, well, for this, I'll keep you sitting down, but if you can just tell me where the
I
pain
can stand
is.
up and show you better.
Oh, is there some
There's
bruising there?
the pain here.
Yeah. So, or you can point to it on me. Is it what, just above?
Oh, I'll just show you myself, David. Oh, I got all this stuff. I can't move. Can I?
Yeah, we
That's
have
what
a
I'm
few
saying.
wires
Oh,
attached.
no, sorry. Here,
So, sort of on your right, on your left.
there.
Yep.
And then it comes to here.
To sort of start at the back and
And
radiate
then it's
round
like
to the front.
like a nerve pain, I think. It goes down my left leg into
With
the
all
knee.
your other health complaints, have you ever been diagnosed with like sciatica? Like,
Sorry, no, I just need to keep going.
Well, I've got my feet are pins and needles.
yeah, is that normal or is that a new thing for you?
Oh, it's been before, but it seems to be worse now.
So you've had it in the you've had it normally a little bit, but it's worse today.
Yeah.
Okay.
What do they call neuropathy or something? Neuropathy.
Yeah, I think that's the right one for
Sorry,
it.
just have to
Yeah.
get on the side here.
Good on you, David. I appreciate that, and Kevin.
Do you normally ever get any sort of pain in that sort of area?
Uh,
There we go. We can put this down.
all the time. This has been going on for a long time.
Okay, so
I've got, and it goes.
It's a
The
chronic
pain,
pain. That's
the
just
pain
worse today.
is in, like in the shoulder, in the joint,
Yep.
Oops, sorry.
and here, and then it'll go here down here.
Yep.
And I use heat packs. I've got massage machines.
Have you ever been diagnosed with like a gout or a
Yeah, I got gout.
You got gout? Are you on the regular
and-
medication, leg gout or pro gout or something for that?
I can't. It's too
Not
rough.
for one of them?
Too rough.
Oh, it doesn't.
Oh, I take Xyloprim.
Yep.
What do I take? 80 milligram, I think, a day. Hang on. What is it? 200 milligram tablet in half. 100. Well, anyway, I take Xyloprim, and you know.
Is that everything plugged in? George, I'll just get you to stop for a sec so we can have a quick picture of your
Just
heart.
try to lay as still as you can. No talking or anything.
How old are you, George?
I just told you, 67.
My memory's like a fish at times. So.
Yeah.
What was your date of birth?
Don't go to Westmead Hospital. They'll diagnose you with Alzheimer's. 4th of the 8th, 1954. Oh, gosh.
Now, how often do you take the endone for your pain?
I
Is
do,
that just a new
I
one
do
or just-
everything I can to avoid it because I got a
The stoma?
parastoma hernia here, big as a rock melon,
Yep.
and the endone,
Aggravates that,
no, it causes constipation,
which then.
and then that's the last thing you want when
Yep.
you got
Yeah,
that.
Alright,
Science,
sorry, one more
beautiful.
time. Just lay as still as you can for me. No talking. Just want to get a good read on this.
Yeah,
That's all.
that doesn't look too bad though.
Yeah, I know.
I've been begging Westmead Hospital to give me medicinal cannabis, CBD oil.
That's quite hard to get at the moment. I know.
Oh.
I'm not. I know the. I've only been to one or two people. That haven't.
Westmead
There's quite a
Hospital,
lot of,
Westmead
hoops to jump
Hospital
through.
is got tons of it
Do they?
from
I didn't
Sydney
think it was
University. Yeah.
Is that in a trial though, or is that in?
There's,
don't think that's one of the regular
this
ones,
talk of a trial. People have been using it successfully for cancer for 30 years in America and Europe. And they put
One was just popping off his arm. Sorry, I was talking about you, not to you, George.
they're pushing. I also OxyContin. I got that as well.
What's
Yep.
the coding?
Contin.
Contin.
Oh,
That's
okay.
a different one.
And this is what the hospitals are pushing that. And I take OxyContin, and I can't even see.
Yeah, so it has quite bad side effects.
So-
For them.
They got medicinal CBD oil there. The palliative care doctor, Claire Zachalski, refused to give it to me. And the Sydney University are doing a so-called trial.
And they can't get you.
They
into
say,
that
oh, it
trial.
could be dangerous. What about the narcotics? And it's not dangerous at all. In Canberra, it's legal. You can grow 2 bloody plants there. And
Sorry.
if I had 2 plants, if I could, legal here, I could put 2 plants here and you just put it in a cup of tea.
Mm.
And then they push in heroin and morphine. I got a bottle of morphine out there.
Okay, and that doesn't work for
I
you
don't
anymore.
want to use. Oh no, that's the end.
Yeah.
Once you start with that.
So I suppose, George, from my perspective, that's most of the strong pain medications I have are opiate based, like morphine or fentanyl, and if that's causing you problems with your stoma, I wouldn't want to give them to you.
No, I don't want to take because when you get a blockage, it's,
Yeah, that's
it's
a fair
horrible.
comment. Like, I'd be hesitant to do it. 'cause
But
I
the
don't-
hospital's saying, yeah, you must take it,
yeah,
and they got a lot of it there. The so-called trial, they got there, and I begged them for 12 months, and it's evidence. They say it's only anecdotal. There's evidence to prove that it helps with cancer, nerve pain, and in some cases it's even made the cancer slow down and
Yeah.
helped
Well-
in some cases, but they're pushing the narcotics to me.
Yeah.
And basically I've been blacklisted at the hospital. The doctor said you should have a blood transfusion, George.
Well, had they?
And I said that's not an option because I've been abused there. I was shackled there for bloody 4 hours by this doctor, Indian doctor Sanampreet Rajput.
Okay, so and that blood transfusion was for the low hemoglobin they were talking about. Was that the reason for it?
Dr. Wong said, look, he said, get to the emergency straight away. I said, I can't, doctor. And I told him the situation. Go there, they just abuse him, and when you complain, there's no one accountable there.
Okay.
And I was held there for 4 days against my own will, and tortured, unwanted procedures,
George, I can't speak to that because I wasn't there.
No, I'm just talking
that's okay.
about why I can't go to hospital.
That's okay. So, George, from me, what can I do to help you today? Because if I can't give you opiates, well, I don't want to complicate your stoma, and most of the strong painkillers I have that would help you out would be morphine or fentanyl. So if that's going to cause you more issues, I don't want to do that and cause you more grief down the line.
No,
but I also don't want to
I've
leave
got
you in
plenty of
pain.
morphine
Okay.
there and all of that. And look,
So
if you had cancer, or if the doctors at Westmead had cancer, they'd all take medicinal cannabis, CBD.
I wouldn't because I can't get it. But I know what you're saying.
No, but they would get it. And can you tell someone at the hospital to send some CBD oil here?
I've got no means of doing that. I can't dictate what the hospitals do and don't do.
No, just suggest it.
Even if I took you up to hospital and said that.
No, I don't want to see the hospital.
I know you don't want to go, but even if I took you up there and said that opiates don't work for you, it's still up to the doctors as to what you get prescribed.
Yeah.
So there's not a lot I can do for you in that respect, I'm afraid, George.
Well, the thing is, the pain, it's sort of gradually getting worse, and I know there's a cancer mass here growing.
Is there anything they can do about that, chemo or
there's one good
surgery?
one good doctor at Westmead there, very honest doctor, Professor Pless there. He does transplants, liver transplants and kidney transplants. He said, we can put a stent in there. He said, the trouble is it grows back so quick.
It's going to be almost...
And any surgery, people think surgery,
It's risk versus
surgery. I think there's more failures than successes. I mean, if you're in a car accident or something, okay, but there's so many complications, infections, and today the experts at the hospital told me I should have been dead 6 months ago, 8 months
Just with
ago.
all the different cancers and whatnot.
Yeah, but they're wrong. I've been taking intravenous high-dose vitamin C, the sorbic acid, and
that's done the trick for you, has it?
Well, I wouldn't have done the trick, but
No,
it's given me life. But the professor at the hospital said, you got to take chemotherapy again, George. I said, well, Folfox, you ever heard of that? He said,
No,
you
I
have
haven't
to
heard of
take this Folfox, have a procedure. They put a port there, and you carry a bag of chemotherapy,
and
it's pumping in for 2 days a week, 48 hours. He said, it won't kill you, but it'll give you an extra 8 months' life. I've already outlived that without it.
Well, see, it works for some people, it doesn't work for others.
But you don't understand. You know what's in the chemotherapy? It's got mustard gas in it. You know what mustard gas is? That's a derivative in there, and it kills your immune system. When you got cancer, your immune system needs to be strong.
It basically carpet bombs everything in your immune.
It kills that. It's not just your hair fall out, you're vomiting, you can't eat.
Well, that's why anyone that's on
I've
chemo
been
we
eating
treat as high risk.
pizzas and everything. If I was on that regimen,
You struggle to
people
keep
die
any
the
food
first
down.
dose. And even one doctor there, a good young doctor, registrar, Chris
I'm happy if you want to
Chris Malloy.
leads off.
Team leads.
He,
Yeah, I'm pretty happy
he
with
told
George's
me. I said, well, you know, he said, I know chemotherapy's rubbish.
Sorry, it might just sting a little while. It's
No,
got these
that's
dots
all
off,
right,
okay?
mate.
Sorry.
He said, I know it's rubbish,
Yeah.
but he said that's all we got here. And you know, I've done hundreds and hundreds of hours of research, and nutrition and nutrients can help. There was a study done for 12 years of chemotherapy published by the Journal of Clinical Oncology. For 12 years study, chemotherapy does not work 97% of the time. You know, we're not designed to put mustard gas into us. And all those, you see the hospital full of it, and all they're doing is chemotherapy, and you see the people suffer like hell. They probably call you guys too.
Yeah, because anyone that's had that is a high risk of other infections because it has destroyed their immune system.
Yeah, but
along with
the
cancer,
thing
so-
is, why would you want to take it?
Well, it
The Journal of Clinical Oncology said it doesn't work 97% of the time. The Folfox that he wanted to give me, people die on the first dose,
yeah. Look,
and then they
George,
get another blood
I'm
cancer.
going to cut you off there because that's a bit beyond what I can do.
No,
for
no,
you.
no. Well, I'm just, you know,
That's okay.
I'm informed.
That's okay. I do find it interesting. I suppose, George, from here,
You've got to do
I
your
can-
own search.
Yeah.
You know, my mother said you have to be your own doctor.
Yeah, and
I
look,
didn't
if you
know
don't
what
feel
was-
that's appropriate for you, then you shouldn't go ahead with it.
Look, it's I'm horrified to think people are pumping that stuff into them now.
Okay, look, so George, look, in terms of what medications I give you, there's not a lot that may not cause you some additional issues with your pain.
So what could
I could
could you
give
get like an injection?
Well, if I take you up to hospital, I can basically give you some morphine or fentanyl to help with the pain, but that could then have a flow-on effect of affecting your.
No, I don't want to take any morphine.
Yeah, well, unfortunately, that's the strong pain relief I have is opiate based, so it may end up
Yeah,
causing
what's
you
the
some
police
grief.
here for?
I'm not sure, to be honest.
What's the police? What do you?
I honestly don't know.
We get tagged to every AMBO job, and if there's been incidents in the past where people...
It's never happened before. What's your name, Constable?
Senior Constable McCarthy.
What's your name?
I said Senior Constable McCarthy.
Can you leave the premises? You're
No, at
not
the moment, no.
you're not wanted here, mate.
At the end of the day, we're here for the AMBOs, and I'm recording
No, you're
our
not.
interaction.
No, you're not. You're in my home.
That's fine.
I've had them come in the past few times, and you know,
So, George,
you're not welcome. Can you please leave my home?
George, can I
I'm
just...
not a criminal, mate.
I'm
George,
not saying you are.
George,
No, well
This
go.
is
go
normal for us to be here.
Look,
It's the
just
safety of
leave.
the ambulance.
George,
Listen,
George,
just leave.
George,
okay.
can you listen to me for 2 secs?
Listen to the ambulance. I'm just here in the
No,
background.
well, get out of my home,
George.
mate.
I'm not getting out, so...
George,
Huh?
I'm not getting out.
What
Listen
regulation?
to the ambulance.
George,
I don't need a regulation. I'm here with the ambulance.
You're causing me
George.
stress, embarrassing me with my neighbours, the police. It's not a police matter, it's a medical matter,
George,
mate.
can I stop you for 2 secs there?
Standing there with your hands on your hips and your sunglasses there, gung-ho. You're not wanted here, mate.
George,
I'm not gonna
You are gung-ho.
George,
Wait outside in the street. If they need you, they'll call you. Okay, we're having personal
I
medical.
don't get told what to do by you.
In my home,
Okay?
you do.
No, I don't.
George,
Yeah?
No, I don't.
George.
What reason are you here for?
I've explained
Now,
to you
let me
before.
clarify this.
I've explained to you before.
I don't want to be bullied in my home.
You're not
You're
being
not
bullied.
explain nothing.
You're not being bullied, and you're being recorded by my on-body-worn video.
No,
So,
it doesn't matter.
That's fine. I said you're not being bullied.
Yes,
I'm here
you
for the
are.
ambulance
I've asked you
safety,
to leave.
and I've told you I'm not leaving.
I've rang here because I've got pain, of cancer pain,
That's no good,
and,
sir.
and you're not needed here, mate.
Hang on, you don't make that decision. I do.
Before the police come and the AMBO has told them you're not needed, and they left. Two young
Not
women.
today.
So don't stand in my house like
George.
this. Hands on your hips, 1 foot. Look at you. Have a look at you. I'm a decent person, mate.
I've never said you're not.
Now,
This
now
is
why
how
don't you just leave the house?
No, I'm
You've
not.
been asked politely to leave.
I'm not leaving.
Yeah, well, I'm going to put in a complaint about
You can put
Yeah.
in a complaint.
George,
Okay, what's your badge number?
I don't have a badge number. That's
You
my
do.
name.
You got a badge number.
I've got a badge number there. That's my name.
What's your shoulder number, whatever they call it?
I don't
that's
need it.
English,
Now,
not
please-
policing, George.
Please leave my house.
No, I want you to deal with the ambulance.
Please leave
I'm here.
my house.
No.
What are you here for?
I've told you several times.
No, well, tell me again.
No, I'm not.
Tell me again.
I'm not. It's
What
been
are you
recorded
here-
on video. You've recorded it. It's on
What,
there.
what
Replay
are you doing in
it. Replay
my?
it, sir.
What are you doing in my
For the
home?
safety of the ambulance, and this is a natural
the
thing that we do.
safety?
Ask the
George.
ambulance. Ask the ambulance what
George.
happens.
George,
Well,
sir.
can you wait outside?
I'll wait in the corridor there. That's it.
Okay, well, get outside there.
Don't tell me what to do.
Yeah, I'm telling you,
I'll stay
this
here
is
then.
my home.
I'll stay here then.
Okay, well, I'm going to make a formal
You
complaint
can
about
make
you.
a formal complaint. No
Yes,
problems.
look at the body language.
That's no problems.
Look at the body language.
George, listen to
You're obviously not worried about your sickness, are you?
Hey?
You're obviously not worried about your sickness. The ambulance are trying to help you.
You're saying
You don't
I'm
wanna
not
help
worried about
yourself.
my sickness. Now you're a doctor. Get out of my home.
Huh?
Yeah, this is Australia, mate. Look at this senior constable. You got two hooks there. Oh, joke. What a joke. Well, stay there then.
George, the police. George, I didn't call the police.
Where's
but
he?
if what you said about when you had a bad experience with the ambulance last time,
Who called the police? Ashley.
I don't know. No, she didn't.
Well,
She's
who
she
called
was
them?
standing. I
As I've
I
said, the
honestly
ambulance-
don't know
Every job the ambulance
if there was an incident
tagged,
last
we're
time.
tagged.
Yeah, not
I've
to
got another
co-
job. I've got another job to go to.
not to come into my home.
George,
You're not needed here. Now
George.
I'll ask you politely and kindly.
And
Please,
I've told you
please,
why I'm not leaving.
George,
please leave.
I've told
George.
you why I'm not leaving.
Well, hang on. Tell me why.
I've told you. I'm not
Hang
telling
on.
you.
No, he's
I'm
in
trying to-
my home.
George, I'm
This is
trying-
traumatising me. You're traumatising me. Now, why are you in my
I'm not
home?
going to explain it again.
I've got cancer in both
I'm
lungs.
sorry to hear that.
I've
sir.
got, but no, you're not
Yes,
sorry.
sir.
You just
How do you- how
that's
do you-
just
hang on a
lip
second.
service.
You just want to argue with me about
Not
something.
argue.
Then-
Hey,
then
hey,
help
hey, hey!
you.
Hang on. You're in my home, mate.
I can
Now
understand.
get out and wait on the veranda.
No,
You're not.
I'm not.
Well, just
You're being argumentative,
what?
and
You want to blame
I'm
me?
here for the safety of the ambulance, as I do in every
The
other
safety
job.
of the
And I've had
ambulance.
no other problem with anybody.
The safety of
With
the ambulance. Look at it.
100%.
Taser. Look at it.
Standard
Look at the
stuff.
body language.
Standard stuff, sir.
Sunglasses
Standard
up
stuff.
like that.
Well, I can't wear sunglasses in the house.
How long
can I?
you been a police
Can I
officer
can I wear
for?
sunglasses in the house?
How
No, I
long
don't
you
think
been
so.
a police officer
I don't need
for?
to explain that to you.
Well, you don't seem
Go and
to.
sit down and
Where
sit
were
back
you
to the
trained
ambulance.
at?
George,
That's
Now,
not, that's not
Lou-
something I need to explain to you, sir.
Constable, what's your badge number?
I don't need to give you that. I've told you my
You
name.
do.
I don't.
Yes, you do.
No, I don't. I do not.
Yeah, well, I understand the law says you have to.
No, I don't.
Yeah.
Well, you don't know the law, sir.
Hey?
You don't know the law then.
Well, the law is you shouldn't be in here harassing and bullying dying people.
You're the one that's harassing, not me.
I'm harassing
I'm standing
you
here
in my own
with the
home.
ambulance at a distance. You've come to me. You've come to me with a camera. I'm recording you. You're recording me. I've come to you with a camera. You won't even speak to the ambulance. I'm here for their safety. That's all I've told you. I haven't been rude. Haven't been anything.
Don't raise your voice in my
I can do what I
house.
need to do.
Don't raise your voice. Now, wait out in the veranda.
I won't be told what to
politely.
do. You go and sit back down and speak to
You
the
won't
ambulance,
be
and
told
I'll
what you do.
No, and you go and sit down.
Who are you?
Listen here.
Who are you?
Do you want to go around? I'm not going anywhere.
Leave my house.
I'm not going anywhere. You go and sit back down and talk to the ambulance, and I'll sit and I'll stand down
You're
next to them.
causing me embarrassment with my neighbours, the police.
Okay.
Yeah. Look, you've got a duty of care. Okay.
Yeah, exactly. That's why I'm here.
Yeah.
So you obviously don't know what a duty of care
No,
is.
yeah. Well, you've got a duty of care, and
Okay, we can argue.
I'll be taking legal action about you.
That's fine.
Civil action, mate.
Beautiful. Can't wait.
Harassing and bullying and dying old
You're the
men.
only one coming to me. You're the one
Constable,
harassing.
what's your first name?
I don't need to give you that.
Yes, you do.
No, I don't.
Identify yourself.
I've just told you, Senior Constable McCarthy.
Show me your badge.
I don't need to.
Well, how do I know who you are? Look at your eyes, they're glaring. You on drugs or something?
Okay. That's enough. You do not need to be
George.
accusing me of stuff that I'm not doing.
Don't
So
raise
go and
your
sit
voice.
down. I will, because look at you.
Look at
You're the one that came to me. I haven't moved towards you at once. I've been 3-4 metres away from you.
Wait outside the veranda.
No, I won't.
Right, you refuse to leave the house.
100%.
100%.
I told you I'll go in the corridor. I won't be told what to do.
That's why I'll never call an ambulance
George,
again.
George.
That's
if
why
there was
I'll
a-
never call an
George,
ambulance again.
George, I need you to listen to me for 2 minutes, okay? If what you said about the ambulance and you had a bad experience with the ambulance last time, the police may have been automatically tasked to this address, which is what I
No,
expect.
now he moves out now.
Okay. He's moved out because
Now,
you're
you know-
calm and you're listening to me. That's all he wanted, was for you to listen so I could
No,
understand.
he wasn't invited here. This is a medical issue. I'm dying.
George.
I've got no.
I want you to listen to me for 2
He
seconds.
come in my house uninvited without any
George.
warrant.
If there was an issue with the ambulance last time, they
Just-
may have
Mel,
automatically tasked
Mel.
the police.
This bloke's obviously just
Okay?
got no concern. See now, you'll see now. I'll never ever call an ambulance again.
I'm sorry to hear that.
Look what
George.
you're doing, making me carer cry. I'll never call an ambulance again to have some
George.
senior constable come and bully you, come and bully you with pain. Yeah, come on, you better go too, sir. You
So,
guys, thanks for
George.
trying to help me. I don't want to be embarrassed anymore. Carer's crying. Coming in here, Easter Sunday. Easter Sunday. Now go away. Get out of here. Get out of here, you bully.
Who's the aggressive one?
You're a bully. Get out of here, you bully. And who called you? Don't ever come back here again either.
Tell me what to do.
Oh, you're a big tough man, aren't you? Big man with a gun. Yeah, you threaten me more. Go on, get out.
George, come back and
That's right, get out. You put your tail between your legs, you coward.
George,
You coward and a bully.
George, just come and have a seat for me.
See what I mean?
Yeah, look, I would be guessing that if there was an incident. Oh, sorry, George, I didn't mean to step on your foot.
Do you want anything or no?
No, just take it all out. So, George,
Look,
if there's
listen.
nothing I can do for you, I'll
Li-
move on to my
No,
next
no,
patient
lad.
today.
Listen, what you seen what happened? I called for help. I'll never ever call the ambulance again. This is finished. You seen what happened?
Yeah.
Totally uncalled for.
Look, George, like I said,
This
if
is
there
my
was,
home.
I'm sorry for what happened, transpired, George. If there has been an issue at an address in the past, sometimes they will automatically task
no.
calling. Like I said, I wasn't here
Who
last
called
time.
it? Did Ashley call it?
No, she didn't. She was standing out in the corridor.
Well,
the whole
someone
time.
there's flagged my name to call the police.
I don't know who that
All right.
was. I can't
David,
tell you. I do apologise. Are
thank-
you sure there's nothing else I
thank-
can do?
no,
I'm sorry,
look,
all my medications.
I'm
were
at the end of the
from-
road. No more ambulance called again because I don't want ever this to happen again.
George, before I go, could I get your surname? I didn't get your surname when I was writing.
Hang on.
I'm sorry, I don't know why the police here. I don't know how it works. Sorry about that.
You're here. You witnessed it. Where is he? Is he gone? Let me go out with the camera.
Go sit down with them.
No, I don't want to be bullied in my own home. This is terrible.
I have no idea.
We're not designed to put mustard gas in this. And all those expensive hospitals for all the things chemotherapy and you see the people suffer like you, they probably call you guys too. Because anyone can turn that on. Yeah, but the thing is, why would you even pay? Well, the Journal of Clinical Oncology said it doesn't work 97% of the time. The poll box that he wanted to give me, people die on the first day. And then they get another break. I'm going to money off there. No, well, I'm just, you know, I do want it. You've got to do it. You've got to do it. Yeah. I've never said you have to do your own job. Yeah. Well, you don't feel like the program to you now.
Well, that's something I had brought in. It was over burning and I had family like that. So I think it
So what look like we did like an insurance. Well, if I take up
you've been on. Right.
Yeah, well, unfortunately, that's I'm not sure what's the last. I honestly don't know.
We get tagged there in the AMBO job. This has been incidents in the past. But people
It's never happened before. What's your name?
McCarthy.
What's your name?
Then Councillor McCarthy.
Can you leave the premises?
No, at the moment, no.
You don't want to be on.
Well, then we're here for the ambulance, and I'm reporting our action.
You know, you're in my home.
That's fine.
I've had it come in the past few times, and it's, you know, you're not welcome. Can you please leave my home? I'm not a criminal.
You're not saying that. This is normal for us to be here. It's the safety of the ambulance.
Listen, just leave, okay?
George, can you listen to me for 2 seconds? Listen to the ambulance. I'm just here in the
Get
background.
out of my house.
I'm not getting out, so.
Huh?
I'm not getting out.
What regulations an ambulance?
George. I don't need regulation. I'm here with the ambulance.
It's causing distress, embarrassing me with my neighbours, the police. It's not a police matter, it's a medical matter, right?
Can I stop you for 2 seconds there?
Standing there with your hands on your hips and your sunglasses so you come home. You don't want to be like that.
I'm not going to.
You are going home.
George.
Wait outside the street if they need you up for you. I come over to personal
I don't get told what to do, what do you?
in my home you do.
No, I don't.
George, what reason are you here for?
I've explained to you before. I've explained to you
I
before.
don't want to be bullied in my home.
You're not
There's
being
no
bullied.
explain nothing.
You're not being bullied and you're being recorded by me on what you want to be in.
No, it doesn't matter.
That's fine. I said you're not being bullied. I'm here with the ambulance.
I've asked you to leave.
And I've told you I'm not leaving.
I've rang here for a bit because I've got pain or cancer pain.
That's no good.
And you're not needed here, mate.
Hang on, you don't make that decision, I
The
do.
border police come and the ambulance told us that you're not needed, they left two young
Okay.
men. They don't stand in my house like this, hands on your hips, 1 foot with you. And I'll get that. I'm a decent person, mate.
I never said you're not.
And how can you leave the house? You may ask for my leave.
I'm not leaving.
Yeah, I'm going to put in a complaint.
You can't put in a complaint.
No, I want your badge number.
I don't have that number, that's
You
fine.
do, you've got a badge
I've
number.
got that number, that's fine.
What's your shoulder number, whatever they call it? Now, please leave my house.
No, I want you to deal with the
Please
ambulance.
leave my house. What are you here for?
I've told you several times.
No, tell me again.
No, I'm not.
Tell me again. What are you
on
doing?
video, you've recorded it.
What are you doing in my
Replay, sir.
What are you doing in my
The
house?
safety of the ambulance, and this is an absolute thing that we do. Ask the ambulance what happens.
Well, can you wait outside?
I'll wait in the corridor then, that's it.
Okay, well, get out of there.
Don't tell me what to do.
Yeah, I'm doing it.
I'll take
This is
you.
my home.
I'll take you then.
Okay, well, I'm going to make a formal
You
complaint
can make
about
a
you.
formal complaint, no
Yes,
problem.
look at the body language.
That's no problem.
Look at the body language.
You're obviously not worried about your sickness. Oh yeah.
Hey?
You're obviously not worried about sickness. The ambulance is trying to help you.
You're saying I'm not worried about my sickness. Now you're a doctor. Get out of my home. Yeah, this is Australia, mate. Look at this senior constable. You got 2 books there. Don't joke. Don't joke. Well, stay there.
George, the police, George, I didn't call the police. What you said about the
Who called the police? Who called them?
Ambulance said the ambulance, every job the ambulance, tag, we red tag.
Yeah.
I've got another job to go to.
Not to come into my home.
No.
You're not needed here. Now, I asked you politely, kindly.
And I've told you why I'm not leaving.
George, please leave.
I've told you why I'm not leaving.
Tell me why.
I've told you, I'm not saying
No,
what
you did right home. This is traumatizing. This is traumatizing. Now, why is he in my
I'm
home?
not going to explain it again.
I've got cancer in both.
I'm sorry to hear that.
I've got, no, you're not sorry. That's just a sister.
You just want to argue with me about nothing.
Hang on. You're in my home, mate.
I can
Now
understand.
get out and wait on the veranda.
No,
You're not.
no.
Well, just,
You're being argumentative,
what?
and
You want to blame
I'm
me?
here for the safety of the ambulance, as I do in every other job. And I've had no other problem with anybody.
The safety of the
With
ambulance.
100%.
Taser. There.
Standard
Look at the
stuff.
body language.
Standard stuff, sir.
Sunglasses,
Standard
don't
stuff.
look like that.
Or can't we come up in the house?
How long have you been a police
Can
officer?
we come up in the house?
How long have you been a police officer?
I don't need to explain that to you.
Well, you don't
You have to sit down and
Where were
speak to
you
the
trained
ambulance.
at?
That's not something I need to explain to you, sir.
Constable, what's your badge number?
I don't need to give you that, I told you
You
mine.
do?
No.
Yes, you do. I do not, well, I don't understand the law, says you have to.
No, I don't.
Yeah?
We don't know the law, sir.
Huh?
You don't know the law.
Well, the law is you shouldn't be in here harassing and bullying dying people.
You're the one that's harassing, not me.
I'm harassing
I'm standing here.
in my own
You're
home.
not at a distance. You come to me. You come to me with a camera. I'm recording you, you're recording me. I've come to you with a camera. You won't even speak to the ambulance. I'm here for their safety. That's all I've told you. I haven't been rude. I haven't been anything.
Don't raise your voice.
I'm not here to do that.
Don't raise your voice. Yeah, why do you have to raise?
I won't be told what to do. You go and sit back down and speak to
You
me.
won't be told what you do.
And you go and sit down.
Who are you?
Listen.
Who are you?
I'm not going anywhere.
Where's my house?
I'm not going anywhere. You go and sit back down and talk to the ambulance, and I'll stand there.
You're causing me embarrassment with my neighbours, the police. I mean, look, you've got a duty of care. Okay.
Exactly, that's why I'm here.
Yeah.
I obviously don't know what duty of care is.
Yeah, well, you've got a duty of care, and I'll be taking legal action about you.
That's fine.
Civil action.
Right.
Harassing and bullying is going on.
You're the one coming to me. You're the one harassing.
What's your first name?
I don't even give you that.
Yes, you do. Identify yourself.
I've just told you, saying that's what happened.
Show me your badge.
Not there.
Well, how do I know who you are? Look at your eyes, they're glaring. You on drugs or something?
Okay. That's enough. You do not need to be accusing me of stuff that I'm not doing.
No, bro.
I will, because look at you. Look, you're the one that came to me. I haven't moved towards you at once. I've been 3-4 days away from you.
Why outside the ring?
No,
Well, you refuse to leave the
100%.
house. 100%.
I told you about the corridor. I won't be told what to do.
That's why
The ambulance is, I have been.
They said, I haven't called an ambulance again, George.
Maybe it was a chicken, okay?
Now we live down there.
Okay. He worked out because he kept listening to you. That's all he wanted.
No, he wasn't employed. This is a medical issue. I'm dying. No.
He listened to you.
You can't understand that. I'm not here to cause trouble here.
If there was issues and
Well, it's that place, obviously. So now, you'll see, now I'll never call an ambulance again. Look what you're doing, making me terrorist. I'll never call an ambulance again to have some senior council come and bully you. Come and bully you. Pain. Yeah, come on, you better go to school. That's all right, help me. I don't want to be embarrassed anymore. Terrorist crime.
Yeah. Tell Ashley I'll subpoena her too. Yeah. Hang on, look at this.